Chronic venous insufficiency is a syndrome. It's a constellation of multiple problems that come together. It is high blood pressure in the veins that lead to dilated veins and or dysfunctional valves. And these things become symptomatic in patients where they have swelling and pain and achiness and heaviness and restless legs at night. And not any one patient may have all of these things, but many of them are part of their particular experience of the syndrome, of how this manifests itself. Chronic venous insufficiency mostly develops slowly and insidiously. What that means is people aren't even aware, and they come to accept the symptoms that they live with. The swelling, the achiness, the heaviness, the dilated veins, and they think that as they get older, that it's just a part of life. The problem is over time, this can get so severe that you get skin changes, which can lead to infection, and people often will develop ulcerations, which are very hard to heal, very painful. That's the normal course of most chronic venous insufficiency. People who have blood clots, however, can have a rapid course. And after a blood clot, they can go very rapidly into venous insufficiency that is late stage and chronic. But most people, it's slow and insidious. We know that chronic venous insufficiency is extremely prevalent, more so in Western countries, but in the entire world. It is very underdiagnosed for multiple reasons. Primarily, people think it's normal types of symptoms. Estimates in the United States are there are about 300,000 new cases a year, perhaps more. Up to 40% of adults have some form of venous insufficiency or varicose veins, and they choose to live with it. These problems don't tend to be as dramatic as heart disease or high blood pressure or a stroke or a heart attack or their diabetes, and people often will put them off. Sometimes my colleagues will put them off, and they don't appreciate how serious it is and important it is to pursue the care and treatment of chronic venous insufficiency. So it's very underdiagnosed for those reasons. So that's a trick question. It helps to have specialty training. It makes it easier, of course, but it doesn't have to be exhaustive specialty training. Awareness is the key. Awareness of the symptoms of the heaviness, the restless legs, the swelling, the skin changes, the varicose veins, the spider veins, people's sense of burning or itching. All these things can be a trigger or a warning sign of venous insufficiency. And then what you should do is refer it on to somebody who can do a formal evaluation, usually with ultrasound, and make that diagnosis and begin treatment. You can strongly be suspicious, and you can often be right, but really a proper diagnosis requires a formal and comprehensive ultrasound evaluating for venous insufficiency. There are a lot of other medical issues that can overlap, and so the short answer is no, but the suspicion can easily be correct. Undiagnosed chronic venous insufficiency, as I said before, is very insidious, and it steals quality of life first and foremost. People don't go out, they don't participate, they don't wear the clothes that they want to wear. They look and feel poorly, and they live with it. So their quality of life and their ability to do things is impacted. But that's just the bare beginning. As it gets worse, chronic venous insufficiency in and of itself predisposes you to blood clots, and blood clots can be life-threatening. The other side of chronic venous insufficiency is the skin changes and the leg changes that occur. Over time, you get leathery skin that is prone to infection. It's very painful, and you can get skin breakdown, which can lead to ulcerations. Sometimes the varicose veins and the insufficiency are at the surface of the skin, and the skin breaks down over it, and they bleed, and they can bleed quite dramatically. So all these things can occur with untreated disease. So if your healthcare professional isn't picking up on the symptoms and you want evaluation, we will happily see you. We will do a free screening. If you don't have the ability to pay, or if you just want some information, we're happy to set an appointment and do a formal ultrasound. If you're suspicious and concerned, please call, make an appointment. We will accommodate you in any way possible, and we'll help you come to a conclusion about whether or not this is indeed a problem you have. It's what we specialize in. I just want to emphasize how prevalent it is, and that you don't have to live with painful, unsightly legs. We help people look better and feel better every day. And it is worth it to call your local professional, a CVR provider, at least get a screening and see what can be done to help you.